Evening. My name is Alvaro Fernandez, and today I will be presenting the exercise from the textbooks, which is building management skills, and which is gonna be based on the chapter 9. Okay. In order to carry out this presentation, I will be using as an example the company that I'm working for, which is Colony Springs Medical Center. So to start, I would like to present the mission that this company has, which is the following. Colony Springs Medical Center. It is a medical center that cares about providing healthcare services with the highest level of personal attention, always ensuring a complete satisfaction on those who give us the opportunity to serve. So, as you can see, this is a medical center that cares a lot about providing a really good customer service since it is a critical activity in the health industry nowadays. Okay, so the first question of the exercise was, what is the output of the organization? After reading chapter 9, I understood that the outcome of a company is basically what the firm or the organization has to offer and to deliver to the customers. Mm, According to my point of view, it is easier to explain the outcome starting from three different points. The first one is the services that the company offers. The second one is the market segmentation, which is the market that the company wants to approach, and the third is the revenue sources. How is the company making profits and where those profits are coming from? So, in that order of ideas, my organization, the organization that I work for, the services is basically primary care health services, which are general medicine, internal medicine, gynecology, dermatology. We offer labs procedures, X-rays, sonograms, ultrasounds, electrocardiograms. The following month, we will be opening our own pharmacy, and we also offer complementary services for some kind of patients who are the ones that are creating more profit or that represent more profit for the company, which are the Medicare patients. For those patients, the company has developed complementary services such as massage therapies, physical therapy, acupuncture, and transportation. So basically, this is like the service portfolio that Colony Springs Medical Center has to offer. Then the market segmentation is patients from diverse insurances. We accept a really big amount of insurances. It could be HMOs, it could be PPOs, it could be commercials, it could be accidents. So, and though all those patients must be 18 years and older. We don't see kids. So this is basically our segmentation. People from different economical status and which belong to different insurances. We also take patients as self-pay patients and who are 18 years and older. The revenue sources that Colony Springs Medical Center are the first ones come from bind contracts with insurance companies, which are established contracts in which Colony Springs Medical Center receives a certain amount of money for each of the patients that belong to the insurance and that are using Colony Springs Medical Center as the health provider. But also we have another revenue source, which is the fee for service offerings. The fee for services are those kind of insurances that do not pay like a fixed amount month by month to Colorado Springs Medical Center, but when the patient has to go to Colorado Springs and has the consultation and then the labs procedures done and then the x-rays for each of those services, Colorado Springs Medical Center are going to charge some fee, which is a big part of the revenue source of the company that I work for. Okay, the second question was about the chain activities. Which are the chain activities that the company use in order like to produce this output that I mentioned before? So well, the first one is the marketing function. This marketing function to me is one of the most important chain activities for Colorado Springs Medical Center, since is the best way to like expand the business, to create a better reputation, to create a better image, and to remain in the customer's mind. So, in order to accomplish these objectives, Colorado Springs Medical Center employs giveaways, advertising, product and service presentations. Sometimes, since I work for the marketing department, we have to go to different senior communities in which we're gonna find a lot of patients who belong to our like target market. So we're gonna give presentations not only about the services about what Colorado Springs Medical Center is, but we will also be presenting like health topics which are like very interesting for these people who are maybe going through those sickness or illness or any other health problem. We also applies brand presence in health events, health fairs around the area, which is Broward, social media and press. We have like a budget, a monthly budget that we have to spend in all these activities regarding the marketing function, the marketing and the advertising function. Okay, the second chain activity that I think is very valuable and that I think is crucial for Colorado Springs Medical Center is the production function. From what I read in chapter 9, the production function in a service business is the time in which the service is rendered and how this service is rendered according to the needs that the patients have. Okay, it is very important to keep it to understand that in the health service currently the most important factor is the customer service, since patients are totally free. They don't have to belong to your medical center. Once they start going there, they can change or switch their primary care physician whenever they want. So as the patients know they are free and they don't have the obligation to remain in the same place. They are very demanding. They are very demanding because they know they can move in at any time. So they expect the practice to be the best ones. In otherwise, they will be finding another place that will be offering a better customer service. So this is how Colorado Springs Medical Center has to think. And also regarding the production function, I would like to mention that there are some bonuses achievement from insurance companies based on the patient treatment. If Colorado Springs Medical Center cares about the health of all the patients and stop them from going to different specialists and going to let's say hospitals, in this way the insurance will recognize like the labor these practices are carrying out, and in that way they offer bonuses. Why is that? Because when the patients have to go to the hospitals or to the specialists, this is gonna be more expensive for the insurance. But if the price, if the practice is doing a really good job preventing the patients of from having like a bigger health problem or different things, then those bonuses will come, and the production and the effectiveness of Colorado Springs Medical Center of or of whatever other primary care physician office will be better. And regarding the customer service, I think I already mentioned before, it is very important to provide a really good customer service for the patients that are enrolled into our practice. Okay, for the third question, what product attributes do customers of the organization desire? So I took as a base the 5 steps the casebook is mentioning. For the first one, which is low or high price, I think since it's a cultural health perception, people think that health is not very important, and they don't want and they prefer spending a lot of money on vacations rather than spending this amount of money on health. So always what people is trying to do is to find practices that offer like lower prices, which are gonna be more affordable, because they think the health is not a very big necessity. So for the second one, high quality service is basically the efficiency, and the efficiency in Colorado Springs Medical Center is about the referral department and about the prescription department. It's very important that when patients want to go to different specialist offices, the referral department works very hard to have the authorization codes as soon as possible, because sometimes when they want to go to the specialist because it is an emergency, or they are struggling with their health at that moment. So if they don't have very fast their their referrals, that will be a bigger problem. They will start losing their appointment with the specialist, and the appointments with the specialist usually take so long to be assigned. When, for example, if you want to have an appointment like for July, you have to start calling, let's say, from April, in order to have an opening on July, because they are very busy. Okay, the third one, which is quick service and good after sales service, it's basically about appointment scheduling and waiting time. As I mentioned before, the waiting time in the waiting room cannot be longer than 30 minutes, because people are very demanding and they start losing their patience. So when they lose their patience, they start looking for another practice that will be able to offer a better service and also a faster one. Then products with many useful or valuable features. People try to find practices with everything on site. They like going to practices where they will find their general medicine, where they will find their specialists, where they will find dental practices, where they will find the x-rays, the sonograms, the phlebotomy, and also the pharmacies, because in that way they don't have to go to different places to get their prescriptions, or to get their test done, or their CTs or the MRIs. They just will have to go to the same place every time they need something related to to their health. And then the products that are as far as possible customized or tailored, yeah, is something that our patients want, because it's about the relationship they want to create with the doctor. Sometimes you will see patients saying that this doctor comes here only for business, and that they only want money, so that's why they give like 10 minutes appointments. So it's very important that Colorado Springs Medical Center can create like an environment in which the relationship between the patient and the doctor is very close, and in that way the sense of belonging of the patients to the medical center and the relationship with the doctor will make the patients think two times when going to another practice. Okay, and about the improvements that I recommend for Colony Springs Medical Center regarding the four items are responsiveness to customers. First one, increasing the number of employees in the critical departments of the company. As I mentioned before, the referral department is one of the criticals on the front desk because we're having a lot of problems with the entering calls. So if we at least find another employee to work in the front desk and in which in the free times can help the referral department, that will increase the effectiveness and the efficiency of the company and will be very appreciated by the patients. And then CRM softwares are used for data recollection. However, those softwares should have information transformation outputs. It's very important to have softwares that are able to collect and to gather the information. That is also very important to have those applications that transform the data into information that will be applied and that will be used for decision making processes. Regarding the quality, I will say hiring certified doctors for the primary care physician positions in order to evidence a more reliable image. In this way, currently in Colorado Springs Medical Center we have five primary care physicians, but there's only one who is certified by the state law, which is MD. The other ones are PAs, which are doctors in their countries, but they have come here, but they haven't got the license as an MD. They are only nurse practitioners or PAs. People don't like that. They think doctors from other countries, since are undeveloped countries like Cuba or Colombia or Mexico or Peru, they think they are not well informed. They are not well prepared to see them and to have their and to yeah and to look after their health. So it will be very 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 useful for the company to hire at least one more MD, because that will create a more reliable image for the company. Then the efficiency, training certain employees in billing and coding management performance. This will help the managers to have like better performance and to have a better image with the insurance company, which are going to offer bonuses, and which are going to assign patients, a lot of patients, if they see that the practice is responsible, they are doing the right thing, and they are worrying about the health of the patients and the economical management of their health. And last but not least, innovation, which I recommend is to undertake customer retention activities according to the customer needs of the market that represents more income for the company, which are the seniors that belong to the Medicare insurance. The managers, this company has been providing healthcare services for 25 years, but what I think is that time changes and also practices change, and also the way you do business change. So companies have to be flexible enough to adapt to those demanding and challenging changes. This is something I think the managers have not understood yet, and they think the way to sell their image is the same as it used to be 10 or 15 years before. So this is why I've been trying to recommend the idea of um, opening and space and environment for the for the patients in which they can come not only for health matters, also one of the biggest needs of these patients who are the bigger revenue source for the company, the seniors, is just that they don't have what to do during the day. So if the medical center worries about that and they start offering different activities like seminars, like trips to different like historical places around Florida, or just or regular activities like for example domino or playing cards or zumba classes or yoga, this will be very appreciated by the patients and their sense of belonging will increase, which will represent sustainable economic performance for the company. And once we have our captive patients happy with our practice, in that way we will be able to go to the external environment and to find new customers, or in this case patients. Okay, this is basically my presentation, and thank you very much.